Welcome to the Personality Couch podcast, where we discuss all things personality and clinical practice. I'm your host, Doc Bach, and I am here with my lovely co-host, Doc Fish. We are both licensed clinical psychologists in group practice, and today we will be talking about how to spot a personality disorder. So we're going to uncover what the science says as well as your own intuition. Let's hop right to it. This is a really important topic to unpack for a number of different reasons, but personality disorders are not going away anytime soon.
They are everywhere.
They are. Well, personality is everywhere. But personality disorders in particular really stick out like a sore thumb in society. And the more interconnected we become, especially in this digital age, the more we're going to see these personalities that really aren't fitting in with the herd and are kind of sticking out like a sore thumb.
Right. Yeah, there's not really anywhere to hide.
Well, let's talk first about what the DSM says. So that's our Diagnostic and Statistical Manual that we use to make diagnoses. So I want to just look at that really briefly, and then I want to jump into what our intuition and what our body tells us before our brains even register it. Firstly, looking at the DSM, it tells us that a personality disorder is an enduring pattern of inner experiences and behavior that deviates markedly from the expectations of the individual's culture. So this is the not fitting in with the herd,
right?
Sticking out like a sore thumb. And there's a lot of internal parts to that. It's pervasive, meaning it shows up in most settings, and is inflexible. So it's rigid. It has an onset in adolescence or early adulthood. So this isn't just someone having a bad day or a bad season. This has been going on ever since youth, typically, is when we start to see the markers popping up, and then definitely in early adulthood when things are really starting to show up. It's stable over time, meaning that's kind of similar to that persistence.
Right.
Like it's pretty consistent over time, and it leads to distress or impairment.
Even if it's only pointed out by others.
Yes. Yeah. That's the key, because someone who has a personality disorder may or may not be aware of it. Typically not, unless they've done a lot of their own internal work or been in therapy.
Sure.
But this impairment is going to be pointed out by other people. Other people are going to see it. It's going to show up in relationships. It's going to show up at work. It's pretty hard to miss, especially once you know what you're looking for.
That's fair. Yeah.
So where do these problems actually show up then? How do we start to see them?
So definitely thinking. So perception of yourself, of others, of the world, moods. So things like intensity, moodiness, like mood swings, even out of proportion emotional responses or inappropriate emotional responses.
Yeah.
And then, of course, relationships. So if there's ruptures in relationships constantly, or just in social situations, any kind of social situation, work, school. And then we have impulsivity. So, of course, acting without thinking. It's not even necessarily a conscious way. It's not like I'm going to have this social interaction and act this certain way. It's personality, right? It's who people are. It's just at a level where it's disintegrated into a disorder.
Yeah. Yeah. I'm curious what that might look like with thinking, like thinking patterns with someone with a personality disorder.
I want to actually introduce a personality drama triangle.
So good.
There's three positions. Obviously, the triangle has three sides, right? There's three positions. You can take on a rescuer role, a perpetrator role, or like a villain role, and a victim role.
Mm-hmm.
So this is important because with thinking, right? If there's in different personality disorders, you might sit in different places or even slide between different places.
Sure.
So if there's someone sitting in the victim role, their thinking might be like, I'm the one that's always getting hurt. I'm the problem. No one likes me. Everyone is so mean to me. So that might, to some extent, maybe it was true in maybe a couple situations, but that's not necessarily the accurate response. It's like tinted. I would say that's a good way to put it. It's tinted with that victim-y role.
Yeah, I like that word.
And then the rescuer. That might be thinking, I have to help, like, or an inflated ego, like I'm the only one that can help. I'm good enough to help. I'm better than other people, so it's my role to step in. It's power. It's power. And then we have the villain or the perpetrator role. That thinking, sometimes it doesn't come with thinking that's conscious, of course, but it can be, I need to be in a position of power and I need to take over. I need to transfer my pain. Maybe other people are after me, so I have to be abrasive. I have to defend myself. I have to lash out.
Of all the different ones that you mentioned, so moods, we can kind of observe moods going up and down, like
Sure.
labile, what we call labile moods.
Mm-hmm.
Impulsivity, that's observable as well. Like if someone's
Mm-hmm.
making decisions on impulse or just acting on impulse. If there's ruptures in relationships, that's pretty obvious as well.
Mm-hmm.
But the thinking patterns can sometimes be harder to spot. So what you're saying is that the thinking patterns kind of give way to clues if you look at the scripts that individuals with personality disorders follow. Like there's often a triangulation or a role in that drama triangle. And once you start seeing it through that lens, you can see, okay, this is that same script. Okay, this person's a victim again. Now, granted, there can be situations where
absolutely,
like someone really is victimized multiple times, or, like there's legitimate reasons, but in conjunction with all these other things that we're talking about, moods up and down, relationship ruptures, impulsivity, and a script following, if you will, of
sure.
I'm the hero, I'm the rescuer, I have to rescue.
Right.
I'm the victim, there's always something wrong, I need to be rescued, come rescue me. Or kind of villainizing others or being cast in a villainous role. That those types of scripts that are happening on a cognitive level, we get pulled into that.
Oh, absolutely. And that pull can be so strong, and you might not even know that you're in it.
Right.
Yeah.
Right. And I think this is where it gets into intuition. So this is what the DSM says, like what we just talked about. And then we introduce the drama triangle, which can be helpful in kind of understanding what we're looking for. But a lot of this is intuition. It's trusting your instincts, trusting your gut, because what happens is your body knows that you're working with someone who's not following the herd, where there's disorder level personality functioning before your brain even registers it.
Absolutely. Absolutely.
Yeah.
Right. Something just feels off.
Absolutely.
And you may not be able to describe it. You may not be able to think it through. Your emotions might be off. But like something's off and your body knows.
Yeah. Yeah. I even think to like mannerisms or nonverbals. So when you're sitting with that person who has a disorder level personality, their mannerisms, their nonverbals might be inconsistent with what they're actually saying, or even inconsistent with the dynamic that's happening in the room. And this is where it can get kind of meta.
Yeah.
And it's challenging. This is where as professionals, we even struggle with this, but it's not just what's happening, the sort of transaction that's happening. Like right now, Cheyenne and I are having a conversation, right?
Yep.
But if you were to also go to this like bird's eye view and watch the transactions happening and kind of analyze the dynamic and what we're talking about, sometimes your body is able to detect kind of some funkiness in that bird's eye view of the dynamic before your brain can register it, because you're in the moment with the person.
And I think unconsciously, I think that's differences just in general, right? Because we always pay attention to what's different. We always are nervous about what's different. And I think sometimes it's even a safety reaction. It's like, well, hold up, this isn't right. This doesn't feel right. Something's off. Something doesn't feel safe. Even if it's just emotionally unsafe, you might honestly sometimes feel physically unsafe. You might feel, well, of course, with the thinking, you might also have thoughts of like, what's happening? I'm uncomfortable, those kind of things.
Yeah. This is, I think, where it's really helpful to tune in to yourself. Like, if you are a radio frequency, if you're a radio station, turn the dial to your station. Like, what is your body telling you in that moment? So it can be challenging.
Right. Yeah.
Because you want to be with the person and you're having this dialogue back and forth. But also, if you're starting to have intrusive thoughts about, am I safe? Listen to that. Or if you're starting to have intrusive thoughts that you don't typically have, perhaps that's the other person's stuff that's getting transferred into you, onto you in a drama.
Yeah. And this is something that's so difficult to talk about at a high level because everyone reacts differently. So I was just thinking about asking you, Doc Bach, like how you might react versus how I might react. And then I'm even just like, it's maybe even just flight or flight, right? Some people might feel like they need to leave. Some people might feel like they need to fight. It's just so different.
I think it is helpful to get into how each of us respond. So when I'm responding to drama, so drama is like, it's almost like smoke. Where there's smoke, there's fire. So if I'm getting a whiff of smoke, if there's drama happening, I'm going, where are the personality dynamics? Now, not every dramatic situation is going to be disorder level personality. Let me say that too. But if there's consistent drama coming from a person or persons, there's the potential for personality pathology at the disorder level, because where there's smoke, there's fire, and where there's drama, there's often personality disorder or at least personality dynamics.
Sure.
But I feel it when I'm sitting in that place of smelling the smoke or in the drama. I feel it firstly in my gut.
Mm-hmm.
It is a gut level response of almost like a brick or like a sucker punch right above my belly button. Like, ooh, something's up. Like it makes me pay attention.
Yeah.
And to start, and this comes from my training, but to start, okay, bird's eye view, what's going on? Okay, let's kind of analyze the transaction that's happening between us, what's going on, because that gut level response is telling me that this interaction is not just your typical, maybe friendly social interaction that we have most of the time as we go about our days.
Right, because you're going to feel pulled. You feel it in your gut because it's just different. It's a different way that you feel like you need to respond. It defies the social norms.
It does.
So I'm thinking when I first react to it, I think there's a difference though between suspecting it initially and then reacting to the drama.
Oh yeah.
Because I agree with you. I think it's a gut thing. Like I feel it also in my gut. I'm like, it almost feels like a trauma response, not quite so much, but that safety response, which probably part of my personality too. If I'm more like a turtle and if I'm out of my shell, I'm like, my gut's like, this isn't right. Is this a time to go back in my shell? And I think there's different ways that I react depending on the drama. But I definitely agree. It feels very much like a gut thing at first.
Yeah. Yeah, very much. And that's so two things. What we used to call, or sometimes still call, the axis 2 hook is what we're responding to. And that's because of previous classifications where personality disorders were put on a different axis in the DSM. But that hook is what we feel. And it's almost like there's a fisherman's hook, like right in your belly button, and it's pulling. There's something, and you and I both feel it there in the gut, but our personalities are like wildly different.
A little bit, yeah. Yes.
So using a different personality classification system, the Enneagram, which is a great way to understand personality, that's a different story for another whole series. But I am a body type on the Enneagram, and Cheyenne, you are a head type on the Enneagram. So I often feel things in my gut anyway. Your center is your head. But when we're working with these axis 2 hooks or this drama, these pulls, we both feel it at this instinctual level because it knocks us off of our center. It's like something's not right here. Am I safe? Do I need to start assessing resources? Do I need to start putting up a fight? Like at the basic instinctual level, that kind of getting knocked off your center that you don't even always realize on a conscious level is happening because it's at all these other layers
right.
of the transaction socially that's happening. Yeah, I don't even know what I was saying.
Yeah. Well, I think that, but I think that demonstrates how convoluted and smoky it is, right? Smoke is it's not a structure. It's not like you can control it.
Yeah.
It's murky and uncontrollable and everywhere. And then it's, what do you do with it?
Right.
You can very much get lost. I think you can get lost in the personality dynamics as well.
Yeah.
And because it leaks, right? It leaks. It's like it's a lack of boundaries.
Right.
First of all. And it just leaks into, it leaks, it spills over. I think you compare it to an oil spill.
Yeah, it is. It is.
Yeah.
Mm-hmm.
Where do you feel that oil spill?
I feel it in multiple levels. I think I've used that same analogy when talking about when we as professionals, as mental health professionals are unhealthy and our own personality stuff or trauma or whatever spills over into all other areas of the patient's functioning or their treatment team. So I have seen that. I've seen personality smoke really fog up stuff clinically with patients from really, unfortunately, with professionals who are not healthy.
I think it depends on where I'm cast in that personality triangle. That does play a part in it. I think often, so it starts with the gut, right? It's that like initial like awareness of something's up.
Yeah.
And I don't have enough data to figure out what it is. So then I usually feel it in my head, like my thinking. One of the most severe personality cases that I had seen, it was the first report. I could not finish it. And you know me, I want to get everything done. Like I want to get it done. I want to figure it out. It's a puzzle. I love it. Let's do it.
Yeah.
And I could not get it done. I of course got it done by the deadline and it didn't affect client care, but I was confused. My mind, I couldn't pay attention. I felt heavy. I felt like it was just too much to wade through. And that's not a normal reaction at all for me. So that's kind of where I felt it. Now, to a lesser extent, I think I felt it in my emotions as well. I'm part of my personality is I'm very good at compartmentalizing. So emotions stay in the emotion box. And if it's clinical emotions, it stays in the clinical box. But it was leaking, like that oil spill or that smoke. It was leaking into my personal emotions. And that's not something that usually happens with me.
Yeah, that makes sense. So it knocked you off your center. So using, again, Enneagram head type, it knocked you off your center as a head type, maybe intruding into your thoughts, or there was confusion, procrastination. I can't even kind of close this case because it's too smoky.
Yes.
It's too smoky.
Perfect. Yeah, it's too smoky. I can't figure out what's happening.
Yeah. Yeah. Which led to an avoidance, which is you acting out of character because you like to get stuff done and have it off your to-do list and move on to the next thing.
Yes, please.
Yes. Yeah. But that's the piece with these personality pools is they can really make us act in uncharacteristic ways. The dynamic, not that this person is intentionally trying to hook us and pull us. Sometimes that can be the case, but these unconscious layers can pull us in and make us act in uncharacteristic ways. And I was thinking about some examples as you were talking, and this happens not just clinically, but in everyday relationships too.
Yes.
So one of the things that I was thinking about clinically was a case where, I was starting, there's several actually, where I was starting to worry about safety because of what was being projected onto me. So projection is basically when there's something inside of us and we cast it out and we put it on someone else. And then we sometimes call it out in that other person, or it's put on that other person. So when I was starting to worry about safety at kind of multiple different levels, I was like, I don't think this is mine. This isn't my stuff. I don't normally worry about this. This is someone else's stuff that has now intruded into my space because this person or these persons were fearful.
Oh, that's a great point with the projection. So you were working with fearful personality types or structures.
Yeah.
And all of a sudden you're feeling that too.
Mm-hmm.
So I wonder if the core hurt or the core injury on the ego for somebody with a personality disorder is also the same hurt they create or the same pool they create in others.
That's really deep.
Yeah. Maybe not, but it would make sense. So you were talking about safety, and I think if that's fear-based, is that avoidant or paranoid? Possibly.
Sure. Yeah. Yeah, definitely. Yeah. And then other times where I've, been in situations that are particularly smoky or personality disordered, sometimes even I'll start having intrusive thoughts that aren't my own, or intrusive images that aren't my own. Mm-hmm. And this is where it's so important to tune into your own channel. Yeah. Like, again, if you are a radio frequency, like I listen to this station, I am this station, you turn into your dial and really connect with yourself, because the intrusive thoughts and images it wasn't my stuff. Those weren't mine. Those weren't my experiences. Those were this person's over here. And now we're kind of synced up for whatever reason. And that can happen just as we're humans having interactions with other people. It's kind of like when you put something in the dryer, like you have a bunch of things in the dryer, right? Mm-hmm. And you got your lint balls and your hair and whatever else comes out of the dryer. You don't know where it came from. Everything got put in the dryer and there's static, right? There's static electricity. And that can happen where there's just transfers of stuff. And it's like, I don't know where this came from, but that's not my hair stuck in this sock.
Right. That's not mine. Oh gosh, I'm going to think of that every time now. That's not my hair. Not my stuff.
Not my stuff. I had another thought.
Okay.
I also feel it emotionally too. So this is where it disrupts all of our centers. Using Enneagram language again, body, heart, head, all of it. Emotionally, I feel off balance. Okay. So whether this is a clinical situation, whether it's a situation in my personal life, if there's personality dynamics, I start to feel like I was struck by lightning.
Ooh.
Like physically, I don't know what that feels like, but I imagine there's a really sharp anxiety that sits at a different place than maybe average everyday anxiety about things, but it feels piercing, like a piercing anxiety because I'm off balance, off center, because I'm in a drama. And it's hard to calm down. It's hard to come out of that until there's more transactions in the drama triangle. Like if it's almost like if you've been cast in a certain role in the drama triangle and then you're just kind of stuck there, you're frozen. It can feel like, I feel that way. That's a good indicator for me to stop, look around. Where's the drama coming from? Where's the smoke coming from? And start figuring out the triangle. Okay, what's going on? Because if I can figure out my shapes,
sure,
it helps me to get out of this either intrusive emotional space, intrusive thought, or body space.
Right.
Yeah.
Right, because once you figure that out, you can unhook, you can recenter, you can figure out where that hair came from. right? Like it's not yours. And then it doesn't feel so heavy because you're like, okay, like even if I'm, you can still be cast in a role, but when you get that awareness that you're in that role and it's not necessarily reality, it's not so heavy, right? Then it becomes okay, it's not me.
Right.
I am not the drama.
Mm-hmm.
I can step out of it. It's hard to step out. Hard.
Yes. That's the important piece, though. Because I even just said it, like feeling like I need to have more interactions in the drama triangle to feel it's resolved. Like, yep. You don't always have control over that. So that right there is an indicator. Like, if I feel like this isn't going to get resolved until I have this conversation or until this person knows how I feel, or most likely you're in a drama and there's personality fumes.
Yep.
But it also reminded me, keeping with this smoke and fire analogy that we're going in, how do we deal with fire? If you catch on fire, what do?
Stop, drop, and roll. Perfect.
Right?
Oh my goodness. I love that. Okay.
But that can be how we unhook.
You stop, you drop, so you get out of the way of harm or the hook, right?
Mm-hmm.
You roll out of it.
Yeah, you roll out of the triangle.
Ooh, well, okay, so I'm a head type, right? So my initial reaction to that is, well, you collect the information. You figure it out. You put all of the information where the information is supposed to go.
Right.
So what's a good example? I think, especially as therapists, there's often a pull to rescue.
Oh, yeah.
Because people are in pain. They're coming to you, obviously, and we want to help them. So there can often be a pull for somebody in the victim role to pull, like, I need so much help. Like, I need you to rescue me. I feel like there's a common one. For me personally, when I feel that, again, I'm a turtle. So I'm like, that's more energy than I usually give. This is making me want to go in my shell.
Yeah.
So I can even sense it in, like, I'm spending so much time on this email. Or I want to find all of the resources and I have this desire to, like, call them and, like, walk beside them and, like, do it for them. Mm-hmm. It's like, boundaries. That's not our job. So I feel like that's a simplistic, easier example of, okay, this information, I have the information. This is how I'm supposed to do my job. Mm-hmm. This is what I usually do. This is what I am desiring to do. And they don't match.
Right.
They don't match. So let's put this over here and say, okay, this person's hurting. I can give them the tools. That's my job. I go back to my box that I know is true. And of course, that's so simplistic and not helpful for every situation. But do you have any examples like that?
I also find myself wanting more data, even though that's not my center. I'm not a head type or a researcher personality type, but I think that speaks to the power of knowledge in these tricky, smoky personality disorder dynamics, that knowledge is power. And if you can name something, already you're looking at it from that bird's eye view.
Right. There's a disconnect.
Yep. You're not just in the dynamic. You're out here naming the dynamic. So if you can name it, then you can start putting the pieces together. Like, oh, you know what? This has happened before. I've felt this way before. I've had these types of thoughts before. I've wanted to tell this person off before for similar reasons. Like,
sure,
paying attention to those things, because if we can notice that and know that, then it starts to disempower the confusion, because smoke equals confusion.
Right. It's like, how do you get out of the house that's smoky? Where's the fire? Where's the exit?
Right. Right. And it sometimes feels impossible to find the exit because you're just stuck in the smoky dynamic.
I was thinking maybe if you were a body type, you would have different body reactions. But then that's a great space to say we all have all of them. It's just what do we use the most or sit in the most?
Mm-hmm.
And I know you mentioned this before, but I think I want to reiterate that it doesn't happen with every interaction typically.
Right.
Which makes it even more confusing because it's almost like, well, I felt this way last time and there was so much smoke, but like this time we're good.
Yeah.
So maybe there wasn't smoke. It's like second guessing yourself.
Yeah.
I'm just like thinking, it feels yucky. It feels so yucky and confusing.
Yeah. This makes me think of how personality disorders, in particular narcissism, narcissistic personality disorder, is particularly prone to this, but I would say multiple different disorders are, but kind of this reality distorting, shifting dynamics, which we have a word for that called gaslighting, where there's a denial of, well, that didn't happen, or nope, your reality is not really your reality, or that's not how I remember it. That's not how you should feel. Diminishing, minimizing. And then there's this kind of twisty, warped, like different versions of reality. There's the version of reality you're operating in, and then the version of reality the other person's operating in. But because their reality is filled with smokiness, they can't see straight. But I've had situations before where I feel the need to, take copious notes after a discussion with someone, not just clinically, but also just in my personal life. Like, I'm going to write down what happened because I have a feeling that that's going to be refuted because their perception is that it didn't actually happen that way, or that your feelings about it aren't valid. But yeah, I mean, you might find yourself having to like record interactions, like for proof, like that this actually happened. Like, this is where it gets reality distorted, twisty. I think probably this is more messing with your mind.
Yeah.
But some personality disorders, because of that distorted lens, it can, and particularly, again, narcissism is prone to this, narcissistic personality disorder, but it can look delusional.
Oh, sure. Sure.
Meaning out of touch with reality, like completely out of touch with reality.
Yeah. And I think that's a great example. There are other ones that can feel like that too. I was also thinking with the reality piece and the distortions, swinging between the different roles.
Oh, yeah.
That can really make you question reality. So it's, what's a good example? Confronting someone because they did something wrong in your eyes. All of a sudden, they're the victim of the situation.
Right.
But how, and then you're like, how did that happen? And then 5 minutes later, it gets to the point where they're so angry about being the victim that now they're being the villain in the situation. Right. And now maybe you're feeling disheartened, upset, and, oh, well, here, let me rescue you. And if all of that happens in like a 15, 20-minute conversation, my goodness.
It's disorienting. And to your point earlier, this may not be every interaction. So your higher functioning personality disorders that can kind of mask themselves to fit in with the herd, typically it's not going to be every interaction.
Right.
But if it's a pattern that this keeps showing up, even though it's not every time, I can think back on past several months, years, and especially if there's evidence that we have from like earlier on, that like adolescence, young adult age, right? Because we can't just say, oh, they're having a bad season, it's a personality disorder.
Right.
No. But if you're consistently feeling these hooks and these pulls, there's something there. It doesn't have to be every single interaction is like this. We just said it. That's the disorienting part.
I think I also want to take time to point out how disorienting it might feel to the person with the disorder too.
Yeah. That's where it's coming from.
They can't. So on the receiving end, you're feeling disrupted, distorted, completely off balance.
Mm-hmm.
And that's a transfer of pain. That's a transfer.
Okay. So thinking about empathy, there's always a place that this is coming from for individuals with personality disorders. Like they're not consciously choosing to be this way. I mean, typically when we get into the more antisocial, sadistic,
that's true. Mm-hmm.
It can be, but most of the time this is coming, these hooks, these pulls, the smoke, the drama triangle, it's coming from this unstable sense of self. That's one of the core things that pulls together the thread for all the personality disorders, that there is something missing. There's a hole in their understanding of self. Yeah. They don't have a core sense of who they are. And so then we get pulled into that void, void of self.
Yeah. Because they have to fill it.
Mm-hmm.
And so they need something from you because they can't fill it themselves.
Yeah.
And that's where they cast you into a role to create a need or to get something from you to fill their need.
Right. I think of it like someone who's inebriated, right? They're under the influence. They can't walk the straight line. Like they need something to steady themselves because they're inebriated, disoriented. You are that thing that's keeping them steady or from being disoriented, or helping them navigate this social world that they can't otherwise navigate with ease. So something in this transaction is serving that empty sense of self, so that they can get their needs met.
Those pain transfers. So it's typically unconscious. It's a reflex. It's I'm hurting. There's emptiness, an empty spot. I need to fill it. I need to fill it. I need to fill it. It's typical. If you're hungry, you eat. Same concept. But then with that pain, there's a need. And we talked about it a little bit, right? But they perhaps fill it by creating the same hurt that created them.
Yeah. Say more about that.
Okay, so narcissism, right? Narcissistic injury to the ego is that there's a very deep insecurity. And I'm thinking, like, what do you feel with a narcissistic individual? Often they make you feel insecure because they're trying to one-up you. Right? Small.
Yeah.
Perhaps the same way they feel. But in feeling that, they developed coping skills, eventually unhealthy dynamics in order to not feel that way.
Right.
But they transfer that pain. Histrionic. So a histrionic, often their hurt is not being seen. And so they need to create the drama to be seen. In doing that, if you're with a histrionic person, they're taking up all that space and that drama, and then you're probably not seen.
Right. So a lot of this smoke, personality dynamics, can be traced back to potentially early childhood wounds that actually reinforced, helped build those defense mechanisms, the personality structures, which some theorists would argue those are the same thing. Your personality is just a defense. There's a lot that goes into the making of a personality disorder. And then there's a lot that's pulled from us as social beings to do something, to act in some type of way, or to not act. There's pulls. So on that note, I think it's probably time to land the plane. There's so much that we could get into with spotting personality disorders, understanding personality disorders, but the one big takeaway from this is trusting your intuition, that there's a gut level knowledge that we have that was hardwired into us that something is off. And we have to pay attention to that so that we can stop, drop, and roll outside of the personality drama triangle so that we can think clearly and respond appropriately and not just react. All right. Well, that's a wrap for today. Thank you for joining us on this episode of The Personality Couch. Join us next time as we dive deeper into personality disorders as well as personality types and structures. Be well, be kind, and we'll see you next time on The Personality Couch. This podcast is for informational purposes only and does not constitute a professional relationship. If you're in need of professional help, please seek out appropriate resources in your area. Information about clinical trends or diagnoses are discussed in broad and universal terms and do not refer to any specific person or case.